If you're watching this video, you or your family member is probably being treated in a hospital for suspected COVID-19 infection. At present, there are no proven treatments for COVID-19. We need to gather reliable evidence through research and clinical trials. Research is an important part of the government strategy to stop the coronavirus. As this is a new disease, we need to develop treatments as soon as possible. We're inviting you or your family member to join important research studies happening in your hospital and others across the UK. With your consent, we plan to start collecting and analysing new blood samples from you. We'd also like your permission to use blood samples which have already been collected and which would otherwise be discarded. Such samples can offer us vital research insight. To learn more about how COVID-19 works, we also want to analyse your nasal swabs, urine, blood and tissue samples. We hope to identify specific genes that cause some people to be more susceptible to COVID-19 than others. We do this by comparing the gene sequencing of healthy people to those suffering from COVID-19. We hope that our gene research will also enable us to offer better and more targeted treatment for patients in the future. These studies do not use drugs and are known as observational research. These studies pose no added risk to patients. We will collect certain blood samples during patients' stay in hospital and a final set a month after they've been discharged from hospital. Some of these samples will be held at the Barts bioresource, which is a storage bank used for further analysis and genetic testing. Patients consenting for these studies will have their health records collected and stored for the rest of their lives, but please note that all personal information will be removed first. If you agree to be part of our studies, a member of the research team will contact you. If you are too sick to decide for yourself, an independent clinician called a nominated professional consultee may decide on your behalf. In these circumstances, we will try to contact your next of kin to obtain consent. It is also possible that you have received this video because you have already been enrolled onto our research. This might have happened when you were too poorly to consent yourself. For instance, you may have been on a ventilator or receiving other treatment. We're contacting you now at our earliest possible opportunity to explain why this has happened and to ask for your continued consent. An independent medical research ethics committee has approved every study. Should you have any questions about any of the studies, please speak to someone in your care team. Participation information sheets for each study are available. So thank you from the research team at Barts NHS Trust. And thank you for supporting the NHS and research during these difficult times.